welcome to the Steve Marchand podcast. Thanks so much for joining us again. I don't know where you are listening, but when we are recording right now, it is snowing more than I think either of us thought it would, which makes for pretty good timing to have a conversation because we're not going anywhere anytime soon, it looks like. And I'm really pleased today to have a stalwart of New Hampshire government, of policy, of politics, a friend, and I think one of the most effective leaders in the state of New Hampshire, State Representative Mary Jane Wallner of Concord. Mary Jane, how are you today?
Just watching it snow out my window, and I'm glad to be here doing this podcast with you.
Oh, so glad to have you here and your time, and we respect all elected officials' time, but you are in the teeth of it as we record here in the end of the first week of February. You're in the teeth of the legislative session.
We are.
You not?
We're really in high gear down at our new place where we meet at the Granite Place instead of the LOB, because the LOB Legislative Office Building in Concord is under construction for a year and closed down. So we have moved down to a new location for all our committee hearings and our committee meetings. It's been interesting.
Now, what's that been like? Yeah, what's that been like, both from the perspective of a lawmaker and from what you can tell, the perspective of folks, whether they're constituents or lobbyists or whoever, trying to get in? Has it complicated it a lot?
They did I think they did a really good job, actually, of orienting the legislators into the building, because the building is different, and there are other state agencies there. So they did a good job, though, getting us oriented to the building, how to use it, where things were. So people seem to be really adjusting to it. The rooms got remodeled and are really quite spacious and very, very comfortable. I think the public maybe have had a little more trouble finding the place because it's a little bit off the beaten path. It's not right downtown Concord, but the parking is great. So that's one of the really upsides of it.
Oh, I mean, the parking, going back to when I was in local office, nothing gets people more fired up on a day-to-day basis than the availability or lack thereof of parking. So
yes,
that's very good news.
Good parking, but you miss being downtown Concord, and you certainly miss being so close, right there by the State House. So those are the downsides, but the parking.
So next year, right? So next scheduled for the new building to be open in time for next January.
That's the hope, that we'll be back in there by next year at this time. We will be functioning back in the LOB.
Well, that'll be great. So, of course, there's miles to go between now and then. So, look, you know this. You have served, first elected in 1980, correct?
That's right.
You've seen it all.
I've been there a while.
You've seen it all.
I have been there a while.
You've been majority leader at the times when we've had the majority, which hasn't been that frequently, but it does seem like we have we as lifelong Democrat, we are poised, I think, a real chance to regain the majority in the House. Obviously, a lot of miles there too. But what's it been like, particularly in this last year plus of this current body, this current legislative group, working in the minority with a group that's been throwing some pretty wild stuff up there? Some of it passes, some of it gets killed. What's that environment like here as in the second year of this 2-year term?
Well, I mean, as you said, I've been there a long time, and when I first was elected, and for the first 20 odd years that I was there, more than that, almost 25 years, the Republicans were always in the majority. But this is a very different feel than it was 20 years ago or 30 years ago. This is a different group of Republicans, for sure. And it's more difficult to work together on projects. I can remember when I was first in the legislature, the first 5 to 10 years, I often worked with Republicans on bills, and we, really worked hard, and we compromised on things. it's harder now to forge those relationships. And I feel bad about that. And I sort of miss it. I'm on the finance committee, and
Yeah.
I can remember putting state budgets together with Republicans that, maybe it wouldn't have been exactly the way I would have liked to have done it, but we worked together. There was that feeling of working together. It's less so that now than it was back in the old days. And I hate doing that back in the old day thing because it makes me think of my father when he would say, back in the old days.
Well, I mean, when you look back at it, though, do you see it as a gradual change in the Republican Party, or is there an inflection point where a more dramatic change in we'll say the center point, the fulcrum of the Republican Party occurred?
I think it was fairly gradual up until maybe 5 to 10 years ago. And then I think I really felt the shift.
Yeah.
It just got harder to find people who wanted to work together. It was definitely the Democrats on one side, the Republicans on the other side. And it was harder. It was harder. And it seemed like it was sort of gradual, but then it did take a big shift in about maybe 7 or 8 years ago.
Is that a free state thing? Is that a Trump thing? Is that a little of everything?
Well, I think it might be a little bit. I think it is the free state. I think it has a lot to do with the free staters. They have definitely gained in power in the in the New Hampshire legislature. They definitely are in charge of the Republican Party in the legislature. So I think it has that. Probably Trump to a certain degree. Just a number of things. If I knew what the answer was, I would. Everybody would be coming to see me and to find out what the answer was.
It's probably is a little bit everything. I mean, I look back and I started in New Hampshire politics in the early 2000s. So that's my window as I grew up here, but being active. And it seems like there was this difference, including on the idea of revenue, that it went from take a pledge for no new big, like an income tax, sales tax. And it seems like it's transformed to, if you oppose a cut in an existing rate, that is treated as egregious as if you were out there proposing, some big new tax or something. It's getting treated politically, at least within that cohort. It feels
Remember,
like the same
all
way.
taxes, every tax in the state, I believe, was probably put in place by Republicans.
Yeah. They've been in charge almost the whole, 250 years.
I mean, they were all put in place by Republicans in order to make government work. And that was the way it was approached in the finance committee when I was first on the finance committee in the 90s. And you needed to have revenue. And I was there when the BET was introduced, the business enterprise tax was introduced. And that was introduced and supported by a Republican governor. That wasn't a Democrat. Yes,
Steve Merrill, right?
So, but now you're right. It's not just being anti-new tax. It's just anti even the taxes we already have.
And I feel like in the last few years, in a lot of the analytical work I do, and also looking at public and some private polling, the voters of New Hampshire, and this is across party lines, I think, have increasingly, after my entire adult lifetime, there was this willingness or cognitive dissonance between the tax that hits most New Hampshire families the hardest, property tax, and any responsibility at the state level, any connection between that really painful property tax and the behavior of decisions in Concord. And it seems that in the last 2 to 3 years, less than 5 years, voters are proactively making this connection that says, I don't think it's just that I got a bunch of selectmen or school board members who are wild or something. They know these people. These are their neighbors and friends. So if it was them, they would know what to do. They'd kick them out. That's not what's happening. They're saying, I think it's connected to Concord. Hey, Concord, what are you going to do about my property taxes? Because it seems like what you're doing is the opposite effect of what I need. Do you get that sense in your work?
I do feel
that
people
connection?
are making more connection. I think there's a lot of people working on educating people about the connection between state government and the property taxes and how it all works together. So, that I think that's good, and people are beginning to really pay attention to it.
And I think there are certainly opportunities in this session right now to connect those dots further. People are seeing that this open enrollment bill, which is kind of floating over our head here it appears the next couple of weeks anyway, that's got a chance of being an immensely negatively impactful piece of legislation if that thing becomes law.
And I guess I've seen more of this too, where things are done not in the open. So if this comes to us, I mean, there has been really, other than just all of a sudden in the last few days, really, or week, people have been made aware of it, but there was not did not have public input. And I think I see a lot more things that have been done that way. And I will tell you the one that the car inspection, that the Free State, that was part of their agenda. They wanted to be rid of the car inspection, and it was put in the state budget. Getting rid of car inspection is now a major piece of the state budget, being put into the state budget at the last minute. And it had very little, at that point, it had very little public input. Then there it is in the middle of a bill that is House Bill 2, which is 250 to 300 pages long with, wow. And there it is in the middle of that. And it's the whole budget is being voted on. And at the same time, they were doing away with car inspection inside. And I feel like this one's sort of the same, that they sort of put it on in the Senate at the last minute. And the public are not going to have really a good chance to weigh in.
I think it strikes me that this procedure, this use of procedure to basically take impactful bills that they know are at a minimum controversial, if not unpopular, if put into the light of day, jamming it in to avoid this public hearing and the press being able to really dig in with this open enrollment. As I understand it, as long as the House were to approve it, vote for it without any change to what the Senate kind of snuck in there to tuck it into an unrelated bill, then that would be it. No public hearing opportunity. That's the beginning and end of the conversation.
It would just go to the governor for signature.
It is. I mean, I am pleased to see, and from what I understand, there's some delay in its likelihood of being voted upon.
We didn't a lot of
which gives more opportunity.
A lot of people thought that it would have been on the floor on Thursday, this past Thursday, and it wasn't on the calendar. It did not. It did not get acted on Thursday. So I don't know why the delay, but certainly the delay has given us a lot of opportunity for people to reach out to us. And I know my school board reached out to me. Certainly we've had a lot of statewide groups have been reaching out. But I was glad to hear from my own school board about it and how they felt that it would affect my community.
So that's speaking. So you represent
Yep.
Concord. You are Ward 5, if I my memory is
Yes, that's me,
correct.
Ward 5 Concord.
Uh, okay, yeah. So it's interesting. People think of this fall. I teach a grad course at UNH on campaigns, and one of my students is a school board member in Concord. Great student, and seems like great school board member as
Good.
well. I won't say the person's name, but the person did great in the class. And I was following the doings of the Concord School Board vicariously through the student. And as a former local elected official, I find it to be the most interesting in a lot of ways. And again, the connection between the decisions going on at the State House down the street, in
Hmm.
your case, and what that's going to mean at the local level. I have always found how do I put it? The interaction, the interface between the school board member and the public, the city councilor and the public. It is so rough.
Yes.
I mean, because there's nobody, you are the ground floor of this stuff. Do you find being a state rep from Concord, one of the shortest commutes of any state representative, probably? Is there a uniqueness to being a Concord state rep because of the proximity? You're right there in the capital city. Do you get hit? You go to Hannaford's or something. Is it just more layers of engagement because people know you locally and as a state rep?
Well, I don't know if it's more because I've never represented anybody any place but Concord, so it's hard for me to judge
Yeah.
whether it's more. I sort of figure that the state reps from the small community, really small communities, probably know everyone in their community. Like I feel like I know a lot of people in my own ward. It feels like my little community. Um, I don't think it's more. I will tell you that because I'm from Concord, and because the state employees, many of the state employees are in the Concord area. I get a lot of people who are state employees reaching out to me about state employee issues. So um, I think that might be one of the big differences between being a state rep from Concord as opposed to someplace else in the state, because the state employees are here and are my constituents.
That makes a lot of sense. I look, there's so many issues that matter, but we were talking before we started today. There may be no. I'm not just being nice. There may be nobody in this 400 person state house, so it's no small statement, who has a better and deeper perspective on one of the, I would argue, seminal challenges facing households today in New Hampshire: childcare. So when we were connecting to have you on, I absolutely wanted to carve out some time because in my day to day life, my kids are now in college, right, or just out of college. But when I look back at most of the prior 20 years, certainly about a 10 or 12-year block of our life, it was one of the drumbeat
Hmm.
stressors of our life every week. What if when we found somebody, if they retired? I mean, that was going to be an absolute catastrophe. Finding somebody was one of the most stressful. I mean, it's so
It
real.
is.
Why? Like, set it up for us a little bit. We have this shortage of professionals. It costs so much. They don't make any money, really,
No.
compared to a lot of other fields. Why is the math so off on this?
Well, it's a lot more complicated than people think it would be. Um, Childcare ends up being a, a profession that, as most people know, does not pay very much. It's one of the lowest paid professions out there. And I actually, at a public hearing last week, I heard a gentleman give some testimony about childcare. And if you had 100 people lined up and each of those people have an income. The child care provider would be number 2 lowest income out of 100 people. So we're in the lowest 2% of wages. And the average child care worker in New Hampshire makes probably around $15 to $16 an hour. And
Wow.
there's a lot to it. There is a lot to being a child care provider. There's a lot of regulations to know. There's you got to be talented with caring for young children, understand child development. Um, you have long hours. Most child care providers in child care centers are open 11 to 12 hours a day. These are businesses that are open a very long time.
Right.
So you're not just talking about one shift of people to work in the child care center. You're really talking about a shift and a half. You need to have people before and after the 8-hour shift. So it is a complicated profession. And unfortunately, in New Hampshire, there are some estimates that we probably need about 55,000 slots, 55,000 places for kids to be cared for. And we only have 44,000 licensed slots. Okay, so
Wow.
we're already short. If those estimates are correct, we're already short. And then recently, the Department of Health and Human Services did a survey with all the licensed providers in the state. Now, I don't know what the return on it was, how many, but from their returns, from what they saw, was that of the 44,000 slots, only about 85% of those slots were actually being used by children. And the reason was because a lot of providers had classrooms closed down. They had their classrooms closed down because they could not staff them. And the real problem facing childcare, the quantity of childcare, the amount of childcare available in this state, is that we do not have the staff. And we've been working for the past 4 or 5 years on staff recruitment, staff training, having programs that will help us recruit and retain staff. I'm actually a retired childcare provider, but I still feel like I'm a big part of it, and it has changed even a lot since I retired. The staffing has become even more difficult than from the many years that I ran childcare. In only 1 year, from 23 to 24, we lost 8% of the childcare providers in the state. We can't continue at that rate, or we're going to have a serious problem. We're going to have a much more serious problem if we continue to lose people. 3 years ago in the state budget, $15 million was appropriated for child care recruitment and retaining program. And that $15 million, it took the state, it could have gone out in July of 23. That was the first year of the state budget. It took the state until August of 24 to get that money out the door and to providers. The program providers could have done a number of things with the funds. They could have used it for bonuses, for recruiting new staff. They could have used it for bonuses for retaining staff. They Could have used it for wage increase. They could have used it for health insurance, all benefits for employees. Most child care workers in this state work without any sort of health care benefits. So health care benefits were a big part of what a lot of the employers used the funds for. Using for education, helping some of their staff further their education. Some used it to help staff pay down education loans that they had. And also it provided funding for things like CPR certification, first aid certification, all those kinds of trainings you really need in order to be a child care provider. So the $15 million was in that 2-year budget, but only went out in the second year. So providers started putting together their programs, what kinds of things they needed to be doing to recruit and retain staff. And it was time for a new budget. The Department of Health and Human Services put the $15 million in their budget request as a prioritized need. And that request went to the governor as she put her budget together. And she deleted it from her budget.
Deleted it altogether.
So the child care industry in New Hampshire, the child care profession in New Hampshire, lost $15 million worth of funding in the next budget. Fortunately, the House did put the $15 million back, but used some federal funds instead of general funds. The first year that it was funded with general funds. They put some funds back and funded it with some federal funds. And during the budget negotiations with the Senate, the whole issue around whether or not these were really funds that could be used came up. The budget ended up with a little footnote in it that said that the Department of Health and Human Services had to have permission from the federal government to use them that way. And because we're still waiting really for a clear answer from the federal government, some people think they said no. Some people think they said maybe. Since there's still no clear answer, none of the money has gone back out to the providers. So the providers had a program for a year. Really, we're trying to put together some great ideas to recruit and retain some providers, and get those empty classrooms open. I mean, we don't need to reinvent the wheel. We don't need to go out and build more childcare centers. That's not the problem. We have childcare centers that have classrooms that are furnished. They've got all the toys. They've already been licensed. They're all ready for the kids, but there's no staff to staff them. So we're still in a debate about whether or not the funds will go out to the providers.
Wow. I think that is probably I don't think that is widely known, that this meaningful part of addressing the problem is not the lack of slots. It's the lack of personnel required to be able to man the slots. Which on one level, I'm trying to get around my head right now, am I encouraged or discouraged by what you just said? Because there's an element that goes, well, that's one barrier. That's of course, as you noted, a very complicated set of challenges that go into this. But one of the significant parts of it seemed like this is a little more doable in theory, because there's one barrier that's a little less scary than I might have thought before I heard that description. But in terms of how much of this, in your estimation, and as you noted, I mean, you underplayed I think the depth of your experience. I mean, you were the executive director, right, of a prominent child care service for several decades in the Concord area until relatively recently. And then, of course, legislatively, you've been in the middle of it, every time
Yeah.
the fight's been on.
Yeah, I was the director of Merrimack Valley Daycare Services.
So,
Yeah.
yeah. So it's not, this is not an academic
No.
or a purely legislative exercise. This is lived experience as much as anybody in that we could get. So how much of the pipeline, if you're going to, is getting new people into the pipeline, into the field? How much of it are folks that were in the field, in the profession, but because of the lack of pay, the lack of insurance, which is such a killer, have had to drop out of it. So they were already in the pipeline, but they've had to drop out of it. How much of it is getting more folks into the pipeline? How much of it is trying to get folks already back into the game?
Well, I don't actually have any, can't give you a number, but I feel like it feels to me like what we really need statewide. Remember, this is the whole state. I would say we're probably lacking, we could probably use between 700 and 1,000 new providers. Because I always figure that every one provider that we are able to bring into the field probably means that 5 to 6 children are going to be able to be cared for. So if we're lacking,
Right.
we're probably lacking, between 10 and 15,000 slots. If it's true that only 85% of the 44,000 slots are being used, if that is an actual figure, and we need 55,000 slots, so we probably could use another 750 to 1,000 providers. And a lot of people have come into this field and only stayed a short time because the pay is very low. There are very few benefits. It's very, very rare for a child care provider to have health insurance, and the idea that they have retirement is almost that is almost nobody has a retirement plan other than obviously Social Security. So it's a profession that is really does not have many benefits to it. So people do enter it. Often people will enter it during the time that their own children are little. Maybe they'll do family child care in their own home, have their own children there, and then have a few other children come in. But they don't stay with it because then they go back into the job market. And recently I was at a Christmas party where I catch up with a lot of old friends, and every year we have this party, and I only see a lot of them once a year. And one of them, their daughter used to work for me many years ago, and she actually had a degree in early education, and she was an excellent child care provider. She took such good care of the children, and the kids loved her, and the families loved her. And I really saw her as sort of a future, a person who could, actually be an administrator and a supervisor of other people. But, she was very talented, and she ended up leaving the field because she was able to go into another field. And she's now been in another field for probably the last 15 years. But when I saw her father at this party, he said, she really, one of the saddest things she ever did was having to leave childcare because she really loved doing it. And it was really her first choice, but she couldn't support herself and her own child on the wages she was going to make in childcare. So we've lost a lot of good people. And we often lose some of our very best and most talented people to the public school system. Sometimes I feel like we're a training ground because, they they pay much better than the child care providers receive.
I mean, that makes sense. And if you think about it, it is truly one of those fields where, because the benefits are scarce, as you note, because the pay is on the low, certainly on the low end, if you are interested in a career in the field, there's a passion. There's got to be a passion behind it, right? It is not a pure spreadsheet decision, because the spreadsheet would not support, right, the investment in your own education and so forth. So, which makes it even more painful when I think about, as a dad, the some of the most important positive influences in my two daughters' upbringing, and the positive effects it's had for them all the way through into college, into how they treat other people, how they treat their peers, just them as people. It's this very early stage of life, childcare providing. And when you find somebody, whether it's a small, for us, it was a small
Mm-hmm.
home based for most of their early childhood, and they were magnificent. And you build a relationship. I mean, anybody who's been a parent knows there's nothing you are not asking. How do I put this? You're not giving more trust to anybody than when you drop your
Yeah.
child off. Right? This is it. This is
Mm-hmm.
the most. This is the highest stakes. So when you find somebody who is worthy of that trust and has the skills to be able to do a great job, I think this is a nonpartisan issue, right? I mean, any parent, Republican, Democrat, non-political, when it gets how important this is. I was looking at some of the statistics. I think this is from the New Hampshire Fiscal Policy Institute. Actually, it is. It was from a study last year, and this kind of gets at the user end of it, the parents, that said that in a two income
Mm-hmm.
family household, the median 20 over 20 about 21% of the median income has to go in a
Yeah.
two income household to pay for childcare. For a single male head of household, a male household, 44%. For a single income where the female is the sole breadwinner, it's
Right.
64% of the median income to provide the medium cost for the childcare. This is absurdity, right? This is not sustainable, and it's proven to not be sustainable. So from the parent end, the frustration is acute. Um, what what can be done on the price side of it? We need the supply. I mean, if we bring the supply in, I suppose that might help with
Mm-hmm.
the supply and demand curves over time. But for the parents that are desperate today, what what can we do in the public realm, or what are the options? Because it's
Yeah.
desperation time.
Well, actually, New Hampshire has done a lot in that area in the last few years around this the Child Care Scholarship Program, which is for low and moderate income families. And we 2 years ago in the budget, this, yeah, 3 years ago in the budget, we actually raised the eligibility for the program to the 85th percentile of median income. And in New Hampshire,
Hmm.
that because our median income is quite high, that does become close to a little over $100,000 for a family of four. So the scholarship
Okay.
program is available to those families, and we have seen an increase in the number of people receiving the scholarship. And in the scholarship program right now, um, families pay 7% of their income for childcare. And that actually comes out of a lot of research and as a guideline from the federal government around what the cost of what a family should be able to afford to provide to have childcare for their children. So our scholarship program is doing that, and we have had a bit of an increase of the number of families in that program since we were running around 3,500 children in the program, and then after the raise to the 85th percentile, we are up to 5,000 children who are receiving the state scholarship.
Oh, wow.
So it has increased, and like I said, we're following the federal guidelines of the 7% of the family income is their share, and then the state helps with the rest of it.
So that 7% figure you mentioned, it sounds like that just as you hear about what percentage of your income should go to
Mm-hmm.
housing, should go to transportation, it sounds like it's the
Yes,
same idea here. That's the best
that's
practice.
and
7%.
I think there's
Okay.
been a lot of
Huh.
research around that, and that actually is federal policy that they suggest for states to follow.
I mean, you see from the numbers from the Fiscal Policy Institute. I mean, you think about the impact, if a two income
Hmm.
household is still seeing more than a fifth of their income go to pay for childcare, this is assuming they can find it. Right? I mean, that's
That's
the
the huge
first barrier.
barrier.
Uh, wow, that's triple the federal
Yes.
standard for best practices. That really puts a finer point on the magnitude of the impact on a fan. And of course, now you take that, now you add on the housing challenge,
Mhm.
and you're realizing there's not a lot of money, and groceries and healthcare, right? And this combination, this
Yes.
affordability crisis we've been hearing about at every level of government. This really pounds it home. There's no money left. Something very important
Yeah.
has to give
Yeah.
at these current
Yeah.
numbers.
And it's for
Wow.
especially for young families just getting started. I mean, I that's most of the families that I knew over the last 40 to 50 years at the child care center were young families that were just starting out, and they were trying to buy a house, provide child care, you know, continue to have their job, and the need for health care has um, been a big financial barrier for a lot of these families. So yes, we need to do more. And New Hampshire is a state that is aging, and we need
Yes.
ways of getting young families to come here and want to be here, or get young families to stay here.
It does seem like in over the course of my lifetime, it's become more acute that we've seen a collapse in the number of school age
Hmm.
children in New Hampshire. And my days when I used to work for UNH, I was a director of corporate relations for several years, and I would go to talk to the heads of HR, CEOs, and so forth, and I would try to figure out what they needed, and the idea was to then bring it back to the university system to see how we could maintain the mission of the university while also addressing some of the needs of employers, large and small, and of course had a lot of UNH alums uh, dotted into all of these companies. And one of the things that became clear, and this was a
Hmm.
decade ago, is some of the assumptions made on campus were reversed in terms of their priority when you went and talked to the HR folks. And so you talk to the HR folks, they would say, we're not looking for handouts. What we're looking for is when we can find somebody who will take the interview that is qualified for, say, advanced manufacturing. And one of the questions that they would have would be, hey, this job sounds great. The pay sounds good. I love the quality of life. But my spouse, while I was doing the interview, my spouse was out looking for things like the school and the childcare opportunities because they're often relatively young. And they would say, I can't take
Uh-huh.
this job because I don't have an answer to these blocking and tackling questions of life. And so they would say, we're losing the employees even after we've invested the money to try to find them and gotten them all the way to the final interview. And then because of these seemingly unrelated factors, it's killing them. So the businesses, when you talk to them, are prioritizing childcare every bit as much as the young family desperately looking for the childcare because they're not taking the
Right.
job.
Yeah. I mean, having more childcare available is also very good for business. I mean, businesses need employees. Everywhere you go in New Hampshire, everybody's looking for someone to take a position, and needing childcare is one of the ways. I One thing that I did when I was still working in childcare, we worked closely with Merrimack County Nursing Home, and we opened a site right at the nursing home because the nursing home was having such a hard time recruiting people to work at the nursing home. Important work. I mean, we need people, and one of their tools was to have a nursing a child care center right there. So when they were recruiting
Ah,
people to be nurses assistants or nurses there at the nursing home, they could bring their children right there with them. Um, and I think there are a few employers, particularly in the healthcare area, that have done that kind of thing.
what a huge advantage when you think about trying to recruit. And if it comes down to a
Mhm.
couple different employers, I put myself in that, 20 years ago. That would have been a game changing, that's a big
Right.
tiebreaker.
It's. I think that.
Uh,
I think.
Wow.
I think particularly hospitals and nursing homes have found that to be a good recruitment tool. But even just working with, for a small employer, I mean, nursing homes and hospitals are large. But even working with a small employer, with a local child care center, to maybe reserve some places at the child care center so that they can recruit employees and use those places. So there are a lot of other ways of increasing supply, getting more child care providers out there, and making it more available for families, and helping employers recruit, because employers really need the help. Some A lot of people call childcare the workforce behind the workforce. It's one of them.
Yeah,
Yeah,
I think that's
it
right.
is.
And again, I think that's in terms of messaging and bringing it into the politics of how we get policy where we want it to be. That strikes me as a very nonpartisan or bipartisan, depending how you look at it, way of looking at it, and it's the accurate way of looking at it. And Well, that's going to be very interesting to watch this emerge over the course of 2026. And I think that as we get into election season this fall,
Mhm.
this is a top tier issue. And certainly for some households, it is right there along with housing, quality of education, taxes, healthcare, childcare. It is all in that very top tier, and has the potential to be a really decisive issue in a lot of political contexts this fall, I
And
think.
now I'm a grandparent, so I look at things very differently. But I even saw my own children, my only child, you know, cons- as she decided that her family, they were going to have a child. One of the big considerations they had was, where are we going to find childcare? This is in
Mm.
their family, in their planning their family. They needed to consider where would they find childcare, and they happened to have been looking just um, 3 years ago, and it was when there was really, we were coming out of the pandemic, and there was a lot of childcare had been closed down during the pandemic, and it was hard getting started back up after being
Mm.
closed for a long time. That's, I think, why we have lost a lot of slots. They just didn't come back. And it was interesting watching her and her husband as they went on their search for childcare. And we're fortunate that they were able to find it. But um, now, as grandparents, we look at it even in a new light. And I think at the legislature still, even though we are fortunately, we have a number of new, younger people there. We're still made up of a lot of grandparents. So I think that a lot of grandparents at the legislature are even seeing it with their own children, what a struggle childcare has become for them.
That's a great way of putting it. I know my parents who live in the Goffstown area have at different points in life. They've certainly been helpful to us
Uh-huh.
at key points, and and this and for my sister, perhaps even more instrumental to allow the the math to work, to allow
Right.
day to day the schedule of life to work, and that's a great fortune that they were available to do that. Not always available for everybody, and it's a stressful situation. So, what part are they? Are the kids in New Hampshire? Did they end up in other parts of the country?
One of my daughters is right here in New Hampshire. She had been
Nice.
actually out of New Hampshire for a very long time, and but married a man from New Hampshire and came back, and they live right here and have a little boy, and it's been quite a quite a thrill for us to have them back here. And my other daughter lives out of state.
Okay. Well, yeah, your daughter is clearly very wise, marrying a New Hampshire guy. This
Yeah,
is so
it was
well done,
really it
mom.
was
Yeah.
really really fortunate. Yeah.
The my when my wife Sandy, my wife and I, we had met in graduate school up at Syracuse University, but had not dated. I was dating somebody else. Like we took a class together, but that was it. And then a couple of years after we were done school, we were both living in the Somerville, Massachusetts area in our respective
Mhm.
careers, early in our careers, and bumped into each other at a gym and ended up going out the next night, and then it started dating, and that was 20 almost 27 years ago. And one of the I think one of the elements of the serendipity is that even though she has Missouri back, as well, you were born in the St.
I
Louis
was.
area, correct?
Yes.
Yeah, so my wife is from the Kansas City area. So, but she had one of her brothers who ended up meeting a Portsmouth girl, and they ended up living in the Manchester area and raising their family. Went to Memorial High School. One of the kids, the whole thing. And Sandy ended up meeting a Manchester guy, me, and ended up in Portsmouth. So but it is pure coincidence that two of the three siblings with these Missouri ties bumped ended up uh, marrying New Hampshire kids, and eventually we just drove past each other on Route 101, I guess, and settled in at
Yeah.
the opposite end of it. But you never know, and I mean, we love living in New Hampshire, but it's not easy from a financial point of view. The child care, the housing, it there's a lot of luck that goes into it, and luck isn't great public policy,
Yeah.
right?
No. It in order to make it work, it really takes some thought and people really do it, putting in the time and the work to get it done correctly.
Well, you've been putting in the work for a long time. So when you look at the rest of this session, the next 2-3 months remaining before we sew it up for 2026, and then I guess move into the political season, what do you look at? What should listeners, viewers, what are a couple of topics or bills that we should be paying the closest attention to in the days and weeks, maybe even the next couple of months going on in Concord?
Well, I mean, I think I think there's something for almost everyone to take a look at. I mean, I think we still have to keep
Hmm.
a close eye on what we're doing around education. It sort of seems like
Yep.
in recently it's off onto, these policies like open enrollment or the education freedom accounts. And we aren't really looking at our obligation and what we need to be doing for the public schools. It seems like it's sort of gotten lost along the way. It's kind of pushed over. Um, I'm really concerned about the funding of special education. It's so expensive.
You have a bill related to
Yes, I
that,
did
correct?
it. It's still down there. It's still alive, but probably just on life support at this point. It's I doubt that it'll make it all the way. Um, but I really think our focus on it has to go. We have got to get focused back on education and not these sort of gimmicky kinds of things. Um, but really our public schools, and how are we going to really have the strongest public schools we can have for our kids. And, what's right for every child, not just some communities having excellence, but every community having excellence. So that's one thing I think we need to really be paying attention to. On a really sort of nerdy kind of thing, in the state budget that passed, we had a $51 million back of the budget cut for health and human services. And I think over the next few months, we need to be watching closely as to how they make those reductions, because $51 million in the New Hampshire budget is a big amount of money. And that's $51 million worth of general fund money. And in the health and human service area, most state money, general fund money, is matched with federal money. So you might really be looking at as much as up to $100 million worth of reductions or cuts in services. So I think that's something we really
Wow.
need to be paying a lot of attention to especially the next 6 to 10 months, because that's when they're going to start really making those reductions. I know they've already started.
And when you say back of the budget,
What? I'm sorry.
when you say back of the budget, for folks that maybe don't know what back of the budget, so those are unspecified cuts, but just, hey, down the road, you all figure it out.
So we do a budget, and we give the Department of, in this particular case, the Department of Health and Human Services, a budget. And then we say, well, this is your budget, but we don't really have enough money to cover all of this. So you have to now, on top of what we've given you, you need to reduce that by $51 million. And you need to find it. As legislators, we're not going to find it. We're going to give it to you as administrators to find, as the executive branch to find. So it's pushing it off onto the exec. I mean, the budget itself might look, okay, but then when you give that $51 million additional reduction, it does not look that great.
Wow. And as you get deeper into the 2-year budget period, the piper has to get paid, right? I mean, that number, and from what I've seen, the projected amount of revenue coming in would actually be higher than the actual, except for this kind of sugar high of this tax. What do they call it? The window where if you owe taxes and amnesty, tax amnesty. Little sugar high from that's masking what appears to be at least some modest shortfalls in the amount of money actually coming in relative to expectations.
I mean, there are shortfalls within certain revenue estimates. The amnesty program is providing kind of a bump in the revenues right now, but that won't last forever. We're going to have to, we'll have to have our usual revenue sources producing, and they're not. And as you know, we've lost a number of revenue sources, and big one being the interest and dividends tax. And then we also are working on, there's been work done on reducing some of the revenue. So we need to be watching the revenues very closely.
It's going to be tight. One last thing before I let you go. You mentioned earlier, and I know you mentioned the bill seems unlikely to become law this time around, but the special ed funding related bill, and as somebody who had been in local office, who've had, it's been a parent where this has been something that we've been familiar with over the years. What, in these small school districts in particular, small changes in the number of eligible special education students are just enormous potential variability in a budget on often very little notice. And your bill is trying to do something to smooth out this enormous impact on a local school district, correct?
Special ed is one of those things that school districts get hit with. Sometimes a new student moves in, or a student with very high need is in a community, and a community ends up having to provide those services. And these services can be very, very expensive. And as I was noticing a lot of these communities that were having shortfalls, um, particularly Claremont, we've all heard about Claremont having large shortfalls. Um, the town of Pittsfield, where I actually have worked in some childcare in that area, was having a shortfall. And I noticed that when they were talking about shortfalls, they were almost always within that was that the special ed needs for the community were higher than they had anticipated. So what my bill would have done would have been had the state um, start helping provide the services, the funding for the services earlier than we do now. Right now, a community has to spend about $70,000 on a child before the state puts in any funding. My bill would have lowered that considerably. Ours right now it's about 3.5 times the state average, and I would have lowered it to 1.5 times. So it
Wow.
would have kicked in a lot earlier. During the hearing, a gentleman came in and made in testimony, and I thought made a really excellent suggestion. And I wish that the education committee would take him up on this. His suggestion was that you might not be able to go all the way down to 1.5%. You might not be able to do that, but start now by doing a little bit. Go from three
Yeah.
and a half to 3 to 2.5, and start the process and get going on it. And not just say, well, we can't do it. And I hope that the education committee heard him and will pay attention to that, and will start making some gains in the education in the special ed area.
Well, I appreciate your leadership on that. That's a great bill. I think anybody, either as a local elected official or as a parent who's had to work within the realm of special education, and it is such a, and so many of the rhetoric about why education costs what it does often has this implication of waste, fraud, abuse. They'll throw out, DEI, these sort of things. And of course, anybody who's actually been in the trenches knows these are not the reasons at all. It is human capital intensive. Healthcare is an element of that. Health insurance is expensive. Everybody knows that. And the special ed component is a sneaky big part of the conversation. So when you said earlier, these kind of gimmicky, let's put a state cap on per pupil spending, almost in a stick versus carrot kind of way. Let's do open enrollment. Let's just blow up the cap on the voucher program. These are gimmicky tactics that don't get at the real challenges. And you can tell these folks haven't actually had to deal with real local budgets, or else they probably would be more sensitive to the real world of it. This is foolishness. This bill, when I saw this, the special ed related bill 1557, HB 1557, this is a very real world. This is an adult approach to dealing with the problem, which I think deserves a lot of attention. So I wanted to mention that at least for a few minutes here before we finished up today, because it's a big deal, and I'm very appreciative you and others who are leading on that. So HB 1557 for folks that care, check it out. I always like to end. I'm sorry. Yeah.
No, I just said thank you for plugging the bill.
Oh, you got it. Yeah, I was going to say. And so while I got you, anything else that you want to plug? It's like this is shameless plug time here. Whether it's things that you'd like activists and residents to do or to pay attention to. We were just talking off air about, and it could be non-political. So, for example, I think we both have quite the passion for our respective breeds of dog.
You do.
Um, so you're a
Yes.
Westie person, you say?
Yep. I am a Westie person. I had two
Um,
Westies, Rocky and Gus.
so, and I have recorded it, so I've not had a chance to watch much of it yet. But Westminster Dog Show, we got corgis, so we're always rooting for corgis. We love all the dogs, but we're rooting there. You were saying earlier that you guys attended the Westminster in the
Yes,
past.
we've gone a few times. It's in New York, Madison Square Garden. Um, it is so much fun because you're surprised, especially the first time I went. I was so surprised to find out that I could go back behind the scenes where all the dogs were being groomed and the breeders were back there with the dogs getting ready for their show. And you could pet them and talk to the breeders and talk to the dogs and really be up close and personal with them. It was so much. If you're a dog person, it was really a great experience.
It's on our bucket list as we are moving towards empty nester status. We're close. I'm not sure the nest is ever really empty, but we're moving towards it in theory. And getting to the Westminster Dog Show is on our bucket list. But when you describe this ability to get more than just sit in your seat like you're going to a hockey game and experience it, this is amazing. I think that's awesome.
It's really fun, and it's like I said, you get really up close and personal with the dogs. It's quite a great experience if you're a dog person.
I guess that's a good point, right? There is an initial threshold. If you're not a dog person, this is not going to be fun for very long. I guess that's a good point. But the other bucket list, and we actually watched it, is because the kids loved it when they were kids and when they were young, and then it turns out even now that they're not young, we still want to watch it. So now we've revealed it was us too. Is the Groundhog Day ceremony there in Pennsylvania? Yes. That's kind of on the bucket list.
Yeah, I guess.
But it's middle of nowhere. I mean, yeah, it's a big bucket.
Yeah.
But it's unlike Westminster. We realize on the map, Punxsutawney Phil, it's truly in the middle of nowhere. So the logistics of it appear to be a nightmare. Not to mention it's awfully cold as compared to being at Madison Square Garden. You got a shot at finding a place to stay. I mean, I can imagine how one does it. But Sandy noted that Groundhog Day and the Westminster Dog Show are often a couple of days apart, the way the calendar breaks down. So I think what she's telling me, we got a road trip coming up.
You're going to do both of them.
I don't know. That's a lot of animal. That's a lot of fur. It's a lot of mammals. So we'll figure that out. But anyway, first things first. When you mentioned that before we went on the air about going, that like as soon as I'm done here, I'm gonna see Sandy and I'm gonna mention it, and I suspect she's gonna go online and try to do something about that. So anyway, but I really appreciate the time today. We got snowed in a little bit here, so the timing was great, but it's such a pleasure. I know you're busy, so I appreciate, Mary Jane, you taking time today to do this and building a little more awareness on some pretty big time issues.
Well, thank you, Steve, and I really appreciate it, and I appreciate the time you gave to talking about childcare because I don't think it really gets as much attention as it should, even though in the last couple of years people are beginning to really pay attention. And I appreciate you doing this today and all your excellent questions. Thank you.
Well, we're going to keep an eye on it. So for the viewers or listeners, you can listen to all of the material at anywhere you get your podcast, Apple Podcasts, on Spotify. You can go on our YouTube channel and watch this and other past episodes of the Steve Marchand podcast. If you like sports, I also have one by the numbers for our sports nuts like myself. We're recording this the day before the Super Bowl. By the time many of you hear this, we will know the result of that. And that will my mood will be much better or worse for a brief period after tomorrow night's game. And also go to stevemarchand.com. That's a Substack where we're going to be doing some pieces on the state of childcare and on a variety of other issues, including special ed, which is another critical issue that, again, I'm not sure gets as much attention as some of the shiny objects that are getting thrown out, like this open enrollment, like the voucher. This is the real world of blocking and tackling of policy. And I'm really glad that we have adults in the room like MJ doing this work. So thanks again for your time. Thanks again for listening, everybody. And we will see you all next time.